Good day, this is Hormoz Mogarei at Kaizened Incorporated. Since lean is a concept and a philosophy, its application in all industries are quite possible and perhaps called for. Lean healthcare is one of the areas that I'd like to focus on today. In healthcare, we can see where lean can be applied rather effectively. There are perhaps three areas that I'd like to mention. Patient care is one of them. The wait time of the patients is another one. And then the cost, the overall cost of healthcare. Patient care, the poka-yoke or air-proofing concept in lean can come to help. There are many reports indicating that the wrong medicine was given to the wrong patient at the wrong dosage. Air-proofing or poka-yoke can help standardize the adult medication and separate it from the children's medication in a way that perhaps is impossible to accidentally prescribe adult medication to children via different size of the IV that makes it very difficult or impossible for the nurses to do it incorrectly. Color coding is another one that will make it more difficult for the healthcare practitioners to make that mistake. Now, when it comes to wait time of people, there is very simple scheduling methodology that we can fix the excess and unnecessary wait time. But instead of addressing the root cause of scheduling, what do? We make the waiting areas larger and more beautiful. We equip the waiting areas with color TVs, variety of magazines, games for the kids so they can entertain themselves, and sometimes even free coffee to divert the attention from scheduling to waiting room or more beautiful waiting room. In the area of cost, it is amazing that you and I, with no unlimited buying power, can walk into a drugstore and purchase 32 pain relievers for $4, for example, while the hospitals with a huge buying power have to charge $8 per pill in order to cover the cost. The irony is that you and I show profit on April 15th and hospitals show losses $10 to $15 million a year and have to be subsidized. By institutionalizing the lean concept and philosophy, healthcare becomes one of the best and most important targets for improvement. A while back, I was talking to a CFO of one of the hospitals in California. He mentioned that his hospital was going through this lean journey to ensure that the cost was in line, the patient care was taken care of, and also the waiting period of patients was addressed. So if patients are scheduled to have the surgery at 4 o'clock, the surgery starts at 4 o'clock. Now understand that there are going to be some abnormalities, plus or minus a few percentages. But by and large, 4 o'clock should be observed. And this seems to be the trend in all hospitals and all healthcare. So if you are in the healthcare, that is highly advisable. Looking forward to seeing you in our next videos.